Welcome to the Roselle Center for Healing educational webinar series. I'm your presenter, Dr. Stephanie Pina, naturopathic physician and licensed acupuncturist. Today we're going to be reviewing how to boost your immune system from more natural methods. And hopefully you'll join us for this series and other parts of the series as well too. So let's continue. There's a growing interest in learning about the immune system and how to treat and boost it naturally. Obviously the biggest thing is because of the COVID-19 outbreak and pandemic. And so more people are wondering how can they boost their own health and what can they do on their own, as well as listening to the normal guidelines as far as social distancing and wearing protective services and gear. And also using things like using immune boosting herbs and vitamins and minerals. Unfortunately, this has now been our new norm. So essentially people are looking for things so they can do in the meantime while there's waiting for some kind of change or vaccination or a cure. And more physicians and patients are coming into the office asking for, is it safe to come in, is asking for what they can do in the meantime. So what we're trying to do is tell them how we can start taking action now while we're waiting to see how things kind of develop, but also to understand the immune system a little bit deeper in order to understand the best ways to treat and possibly come up with an effective cure. So one of the questions I had to ask myself when I was putting this presentation together for you was, would this presentation be the same if I was giving it the same time last year? And it's a yes and no question. No, because essentially we have to take into consideration the different types of immune challenges we're currently facing. Obviously, there's a lot of different speculations and ideas about what's going to work the best, when we should be able to be socially active again, but also what kind of therapies we should be using alongside what we hear from normal conventional medicine. But at the same time, this presentation would still be the same as if it was last year as well. And that's because our immune system hasn't changed all that much over hundreds of years. Even if we look back to the Spanish flu and epidemic in 1918, it's the same immune system and we had less of the drugs and medications to fight it than we did now. So essentially some of the same information that we learned in the past medical history and from different types of cultures are going to help us kind of come up with the ideas that we need to operate and use now in our current system. So what we want to do is take the information from the past and blend it in with the future. And that's essentially what's going to make this presentation different. Our overall presentation outline is pretty basic. We're going to review some of the basic parts of the immune system so we have a better understanding of what we're going over. We're going to start talking about natural immune support and different types of therapies and how they tend to go into work on the immune system in multiple different ways. So it's like looking at the box from a number of different directions instead of just thinking about the box itself. We're going to talk about optimizing your immune system using some of the things that you might have heard in the news or the media, some types of vitamins, mineral supports, but also thinking about it, how do we support the overall body so that the immune system has something to fight? How do we optimize ourselves, the person, before we think about just the immune system, or how do we get rid of the pathogen, or virus, or bug? And finally, we're also going to talk about some of the common myths and misunderstandings that also have to do with some of the challenges that we're presented with this current year. And essentially, how do we learn more about the immune system and natural ways to deal with the immune system that we don't think of or we get skeptical about over time. When we always think about whether it's the immune system or anything in health, but especially for the immune system, we need to think about it from a couple of different ways. It's not just about the pathogen and how we can stop or prevent it. We need to think about how the Triad of Health, this three-sided triangle, as you see here, really presents into it. When we think about how we want to help or cure or speed up a healing process, we have to think about the different structures involved, the biochemistry involved, and also the mental emotional aspect. If we look at the structures, what is this different type of pathogen doing to us? Is it creating pain? Is it creating cardiovascular issues, respiratory issues? What structures is it kind of affecting in our lives? From biochemical standpoint, we know that inflammation is one of the key things that happens, and it's part of the normal immune system, but then when it overreacts, it can create tissues and muscle damage and even start attacking our own body. So how does inflammation play into a key factor of working with the immune system? And finally, we have to look at the mental emotional active. How do we adapt to the current functions? How does our body make sure that there's enough energy to do our daily activities, but also to essentially fight off whatever pathogen we might be dealing with? What happens when we finish fighting it off and we're in recovery stage? Each one of these different parts of the triangle Triad of Health, the biochemical, structural, and mental emotional play a key aspect in really creating a natural treatment for helping to boost the immune system. And it's not something that we normally think about in conventional medicine, where all of a sudden we're looking for the proper drug or the proper cure to kill off a bacteria. How do we help our own bodies fight stuff off and also prevent it for the future as well too? So let's talk about the immune system basics. The immune system itself is a network of cells, proteins, chemicals, tissues, and organs that work together to protect the body from infectious microorganisms such as bacteria, fungus, viruses, and parasites. And when we think about that, we have to think about the fact that it's not only protecting us from these outside parasites and stuff coming in and these pathogens, but essentially it also helps to heal us on the normal occasions. When we have a cut or bruise, our immune system has to stop the bleeding. It needs to take care of the bruising. So there's multiple different aspects of what the immune system needs to do for our body, whether it's working normally. And when we think about what its real function is and the way we talk about it, especially in light of COVID-19 or other pandemics or different types of diseases, we're always talking about its protective abilities, how it protects us from these infectious diseases and aids in the healing process. So in order for that to happen, we have to think about what it does. What are the different individual parts of the immune system that essentially are responding to these? We have different parts of the immune system that respond to bacteria. We have different responses to different types of inflammation, like a general cut, and even to parasites as well too. What information can we gather that helps us come up with the best treatment for a patient in front of us who's seriously ill or is essentially having to recover from a surgery? And are there other functions of the immune system that we start to play on our health that we need to think of? We don't usually think about digestive health and the immune system together, or nervous system and mental emotional health. But the more as time passes, we start to understand that all these play key aspects together. The immune system is one of multiple different healthcare systems within our own body. So we have to basically be able to support all those systems in order for the immune system to survive. When we look at the immune system basics, we can kind of think about it as far as breaking it down into some of the basic things that it makes up of. The blood vessels that are basically carrying around our white blood cells, our red blood cells, and our plasma cells throughout the body. It's bringing nutrients, it's bringing oxygen, and it's removing carbon dioxide and waste from tissues. And by doing that, when the blood vessels bring blood to a tissue that's injured or there's been a pathogen that's gone through the skin barrier, essentially what it's doing is it's allowing us to bring good stuff in and bring stuff back out. The other part of the immune system is the lymphatic system, and these are also known as where the lymphoid cells or parts of the white blood cells that are specific to fighting different types of infections come from. But the lymph system itself can be made up of different tracts or systems throughout the body. There's superficial ones that's just above our fascial layer, and they work deeper into the body, into the fact where you have lymphatic vessels coming out from our digestive tract, from our reproductive glands, and they basically bring all of this waste substance back up to enter the circulatory system close to the heart. These lymphatic systems basically have to go through lymph nodes where essentially pathogens are being presented to different types of cells that are able to fight them and break them down. Some of these glands are also important to us and that we're familiar with are adenoids, tonsils, the appendix, prior patches that are serving as lymphatic tissue that are in the digestive tract, and bone marrow, which helps make some of the white blood cells and some of these lymphatic cells, are all part of the lymphatic system. We also have lymphatic organs such as the thymus and the spleen that helps produce more red blood cells as we start to continue our infection and we fight it off. We need to make more fighter cells essentially to make sure that we can continue with this process. When we look at the immune system as well too, what we want to look at is the first line of defense, and that's our protective barrier. So if we were going to start anywhere as far as our treatment or where we look like we could do the most of it, it's going to be from the outside in. And so the skin itself essentially becomes a barrier on the outside. We don't think much about a cut and a bruise or if we have dry skin, but one of the things that we can think of is that if that skin cracks, it leaves us more susceptible to infections getting in. We have normal bacteria that live on the skin and they commune with us. But essentially, if that bacteria starts to increase or gets into the blood system, it creates issues. There's another barrier known as the mucous membranes, which essentially is secretions that are produced along all of the membrane linings from our nose, our mouth, our digestive tract, our urinary tract as well too. And essentially what that do is it's there to essentially block pathogens from coming in. If we can release this mucus, then we can get rid of them another way as well too. So we have little hairs along, say, our nasal cavity to help move this mucus along. We talked a little bit about the circulating white blood cells and how they're always in the body, moving around through the blood flow, going to tissues, and they're giving signs and signals that there's something going on and they need to be present. Those signals are essentially what creates more inflammation locally. So if we can create more inflammation in a local tissue and then control it when it's done, then we can help boost the immune system. The lymphatic system is also part of our first line of defense, because essentially if we can eliminate out waste as possible and also keep the lymphatic system hydrated with water, we can essentially move bacteria and pathogens to the lymphatic nodes, and then that way they can be seen and fought quicker. Our digestive tract is made up of billions and trillions of different little microbes, also known as the microbiome, and their genes and the IgA factors that help to protect us. Each part of the digestive tract have different cells that help to protect us, everything from hydrochloric acid in the stomach to essentially the appendix, also giving out different types of enzymes and bacteria to help break down different types of pathogens within the food or whatever we ingest. But the digestive tract can also lead into the issues with the eliminatory system. If we don't make sure that we eliminate waste and have normal bowel movements or urination, all the protective abilities we've done throughout the rest of the system fall flat. So essentially we need to make sure that all of these different first lines of defenses, these protective barriers, are well intact in order to create a proper immune system. If the pathogens can't get in these ways, or they're limited, essentially we've already started that way of boosting the immune system. So when we get a pathogen into our system, we get a non-specific response. And so our macrophages it's their job is to go in and to engulf the pathogen and essentially start to break it down so we can introduce it to some of the other specialty cells. Our T cells basically help to break it down some more, so that way we can kind of identify what's going on and gather information of it. What's the best way to treat this particular disease or pathogen? And when we do this, we start to make some of these other cells, the B cells, that makes antibodies, so that if we get this pathogen into our system again, we know how to go. So this is a basic way that the immune system is supposed to respond. Something gets in, we should recognize it, we should learn how to take care of it, and we learn for the future. But what happens if a pathogen like a virus gets into the cells and we don't know what to do with it? Essentially that virus, just like the influenza virus here, would get into the cell and they start to replicate. That replication basically means that they're going to have to make more copies of themselves, whether it's through spreading their DNA or RNA, which a number of different viruses do. And they use the cell or the host cell, which essentially is us, to spread these viruses. They take themselves apart and they put their own replication into our DNA. Then when they release the cells, they go on to the next cell and they can do the same process over and over again. So what tends to happen is when we think about how to deal with viruses, especially ones that are DNA and RNA based, we try to stop the replication cycle before it gets too much. If we can do that, then we may not even have signs and symptoms of a viral attack, or we might get mild symptoms. But if it continues, then it starts to affect not only the local cells that it used to replicate, but also the different other target systems. The cells themselves, like the pathogens, have learned how to invade our immune system. They do this through a number of different ways, and bacteria and parasites, they also have different ways of evading the immune system as well too. So this list is a basic list of how basically the immune system gets tricked into not knowing what to fight and how we end up in trouble. A lot of the bacteria and viruses can produce outer shells, or they start to mutate, so the body doesn't recognize that this is something that it should be fighting. We think of mutations related to like antibody resistance. Our bodies stop paying attention to what's going on with that cells because it's changed itself. It doesn't see it as something that we should be attacking. Those outer cell membranes on viruses and bacteria are also allowed to get into different parts of the body that it may be stopped at. So it may be able to get into the blood system easier than, say, getting stopped at the digestive tract. Different types of viruses also can produce pathogenic chemicals. So that kind of helps to create inflammation in one section, so the immune system goes after that as it sneaks in and starts to replicate. It's got ways of hiding its identity. So on each side of each one of these viruses, essentially, it's got a way of recognizing itself. And if it can block that, it seems like it looks like just like a regular immune system of one of our cells. So it's able to get past our immune system and into tissues where it can replicate as well too. Another way we need to think about how pathogens evade the immune system is the fact that they can go into a dormant state where we have a chronic infection where we don't have any signs and symptoms, but essentially there are still things going on. Different things like stress, poor diet can actually activate some of these chronic infections to come back up. So we see this as if someone gets chickenpox as a child, and then all of a sudden it goes dormant into a nerve. Later on, what happens is if the stressor, their diet's off, or there's other triggering factors, it may come back as shingles, and it follows along that nerve to create painful situations. Parasites can do the same thing, as their life cycles can tend to be a little bit longer. So they go into the digestive tract and essentially they just sit. And they may not create any issues, but essentially an infection that we had a number of years ago can actually still be surfacing as we speak. That's a different way of invading everything that's going on. So in ourselves, we actually create some of these issues ourselves because we have more exposure. We have increased travel, we eat different sorts of foods, our diet's not always great, we have poor hydration at times, we've taken a number of antibiotics that essentially were used to treat, but now those bacteria and viruses have become resistant to it, so we don't have the same kind of response that we had before. There's also issues with testing. If we don't go in for normal visits and we don't get tested for different types of bacteria or different types of inflammation, or if we have any symptoms, we only see the doctor when we're sick, there may not be tests that are that specific for different types of, especially parasites, but also viruses. We see this in the current situation with the COVID virus, not knowing when do you test for a certain active virus presence, or do you test for antibodies, or do you even have the ability to test? But then we also think about the underlying fact too, is that we're not thinking about our overall health and other signs of poor health, such as our comorbidity factors, like do we have any issues with diabetes, poor sleep, accidents or injuries. So pathogens are able to get into the system a lot easier when we're too stressed out or we have other things going on. The immune system needs energy to put into it in order to fight for these. So if it's doing other things and the body's concentrating on trying just to survive, it makes it much more easier for the immune system to allow pathogens to go through. So as our body is dealing with these oncoming pathogens, we know that our system and our blood is made up of a lot of different parts. And the white blood cells are these parts that basically help bring the pathogen basically into the lymphatic system so that we can start to break down the pathogens and then learn from them. And as we break down the different parts of the blood, we see that red blood cells that help bring us oxygen to our tissue, platelets that are available are also helping with clotting response, but the white blood cells are the key for the immune system. And there are a lot of different types of white blood cells, and each one kind of does something a little bit different, but they work together. Monocytes and mast cells basically are part of the innate system that help us to first recognize what's going on and to bring the inflammation response to the localized tissue where that pathogen is. Lymphocytes can help break down later on to become T and B cells, and then essentially going to be able to create antibodies so that we have long-term immunity. And different types of granular cells like eosinophils, basophils, and neutrophils are known to be a little bit more specific in what they're going after. Eosinophils may be higher when there's parasites or allergies. Basophils and neutrophils tend to be higher when there's virus, mold and fungus, and also different types of bacteria. These specialty cells then develop from the lymphocytes and essentially become more and more specific as far as what they do and how they respond. We also have immunoglobulin receptors that are available, like IgM, IgG, and IgA, that help us to neutralize the pathogens in order for us to learn more information from them inside the lymphatic organ systems. And then the different types of chemicals that are released by these cells also help out with the response. So when you hear about cytokine storms or bradykinin storms, these types of inflammation are actually the way we're supposed to fight off bacteria, but they continue long past when they're due. And so essentially chemical signals continue to bring and signal to the immune system to keep fighting the infection and then to kind of continue on. Those two parts of the immune system that you often hear about are the innate immune system and the adaptive immune system. The innate immune system is the part that we don't have to think about. It's always present, it's always going, and it responds rapidly. It's there to basically figure out what kind of new pathogen has now entered the body and where to take the next step. It's there to present these new pathogens to the adaptive immune system, which is a slow response that takes days to weeks, and where essentially antibodies get developed. The antibodies that are developed in the adaptive immune system are highly selective and very specific, so that way we can fight off different types of influenzas, different types of viral infections, and different types of bacteria that we've seen before. It continues to modify over and over again, so that way we get used to the different mutated forms of different pathogens. And finally, infants, when we are born, we don't have a fully functioning immune system, which is why mothers and infants are part of the immunocompromised that they talk about needing additional immune support or even vaccinations. And they have a form of passive immunity that they essentially get through breast milk, from the vaginal canal, in interaction with their mother. So the infant's passive immunity is essentially what they're getting from their mother. That's the beginning of their immune system. The adaptive immune system that we develop later is also where different types of viruses, vaccinations come into play. They're building onto the adaptive immunity, since we're assuming that receiving a vaccination is something that we're going to be fighting off a little bit later on. So when the immune system is working at its best, we're able to fight off infections, and we don't have to worry about the signs and symptoms of colds or flus, of different types of diseases or illnesses. We shouldn't have to worry about what the immune system is doing. But unfortunately, it doesn't work perfectly. There are certain times when we see different types of situations where the immune system goes into excessive overdrive, or it's been depleted and it's deficient. So I like to call this either overactive or overwhelmed. So let's go through a couple of examples when we have excessive situations that's not beneficial for us and also deficient. In excessive situations, essentially what's happening is the immune system has gone into overdrive and it's too reactive. It may have started the process, say, with treating allergy responses to get rid of pollens and ragweed, but essentially what happens is it doesn't know how to turn itself off. It just kind of keeps continuing. And in those particular situations, then you have increased mucus production, which can lead to sinusitis and bronchitis. But when the body becomes too reactive, it doesn't know how to stop it. It thinks it's a new norm. So when we use different types of medications to stop the reactivity, all we're really doing is putting it on hold. The body hasn't learned how to turn itself off yet. Another reason that when excessive situations can happen is essentially with autoimmune diseases. So now the normal immune system has now thought that the normal tissue of the body is essentially a pathogen, and it's started to go after this. There are a number of different autoimmune diseases, such as type 1 diabetes, hypothyroidism, Hashimoto's thyroiditis, lupus, Sjogren's. There's a lot of different areas where the body can be attacked, and it's interesting to see that when cells turn over more and more, such as in the skin, in the kidneys, in the digestive tract, they're really key spots for autoimmune diseases happening. There's a lot of cellular replication, so it sees these new pathogens, or what looks like pathogens, so the immune system goes after it quite quickly. So autoimmune diseases typically come in pairs as well too. So if the body starts to be attacked in one area, that reactive inflammation system will find another spot too. We see this also with different cases of chronic inflammation where the body just can't stop becoming more and more inflamed. In the case of COVID, this inflammation tends to lead to tissue destruction and inability to repair itself. The immune system needs to be able to shut off to go through a recovery process and also create cellular repair. But if it's chronically inflamed, it doesn't do that. This overreactive system can also create other types of co-infections. And we see this with also types of chronic infections, such as with Lyme disease, where you have other types of co-infections that basically take the place on top of the original Lyme infection. These types of co-infections can look completely different, so it's hard to actually identify them at first, or even find them out in testing. And finally, you can also see this with comorbidities, where you start to see the body have other issues start to present, such as having heart disease or liver function, where essentially it's due to an overactive immune system that doesn't know how to turn itself off. On the other side of the spectrum, you do see areas where the immune system has become deficient and it doesn't know how to respond properly. Here we can have acquired deficiencies that may become due to genetic issues or even from different types of treatments. You'd see acquired deficiencies such as when we talk about HIV, and the fact that a lot of the medications that are used there are there to deplete the immune system so it doesn't have this excessive reactivity. But that also leaves us more susceptible for other types of infections. So that's why issues like HIV, the infection is not what actually gets people in trouble. It's the pneumonia and the bacterial infections that come out after. We see this with people sometimes when they have frequent illness. They can't seem to quite fight off one infection, or it keeps kind of lingering and coming back. Chronic fatigue can also be a part of deficient immune system, because essentially the immune system keeps needing to take more and more energy out of the body, so it doesn't allow it to function to its best. We have decreased barrier protection that can also create different types of situations. You see this with lymphatic patients who essentially might have gone through breast cancer treatment, so their immune system is depleted. They may have had lymph nodes removed, so a part of their barrier system has been taken out, and now there's a backup of lymphatic fluid that can't be dealt with. That creates more issues further down the line, and swelling in the arm, legs, abdomen can often be one of the main signs of lymphatic diseases as well. We have the inability to eliminate different substances out. So if we can't get toxins out of the body through normal ways of sweat, urination, bowel elimination, it has to accumulate somewhere. And so the body now basically has an overburdening of what it needs to process. We also see different types of deficiencies in the immune system when people don't get enough nutrients in. They may be nutrient deficient or even caloric deficient. They're not getting enough food into their system for their body to actually function properly. There's been a change off of energy, which we'll talk about in just a second. Different nutrients that are important to the immune system, including like zinc, vitamin C, the B vitamins, magnesium, all are needed in order to function and keep it going properly. But if we don't get that through our food sources, it's going to be not functioning as well as we could. Of course, age on both ends of the spectrum, as we get older and as we're infants and young adults, are a deficient system because either the immune system isn't working as properly as it could or it started to deteriorate. So we know that those types of patients, and then those with other types of diseases or other fatigue burdens, such as women during pregnancy, are typically going to have a deficient immune system, and we need to watch them more carefully. And also one of the big major things is stressors. The increased stress on our body kind of distracts the immune system from being able to do what it needs to do. So we need to make sure that we put stress management part in as far as treating the immune system as well. I started to briefly mention that immune system function is based off of energy costs. And this is one of the studies that was very interesting that went into exactly this idea, that our bodies basically need to have so much energy in order to fight off different pathogens that it has to take it from somewhere else. If the body's constantly fighting off infection all the time, it's going to leave us fatigued. Even when we finish fighting off infection, think about how we feel tired, and we feel like we still don't feel 100% for the next couple of weeks. This has been one of the main things I've seen with patients come in that are post-COVID positive. Once they've tested negative and have gone back into their normal work environments, their increased fatigue is just still there because their immune system hasn't recovered yet. So we have to make sure that we have enough energy going into the body for the immune system to work, and that we can actually be able to function elsewise as well too. Our sympathetic system can only work so well as far as our adrenals kicking in and helping us get through other daily activities until it starts to be suppressed as well too. So we start seeing things that go wrong with us biochemically, structural, and mental and emotional. So in order to think about how do we get the best energy sources in, we can think about this from a food perspective, and also looking at making sure that there's enough sleep and we have enough nutrients to help supply the immune system with what it needs to function properly. Now, there's a number of different factors that are influential to the immune system's health that we're going to be going over and covering during our natural treatment selections. And one is the basic signs of inflammation. When we see these signs, we know that there's something going on with the body, even though we might not have an active infection. But different signs such as fatigue, fever and chills, alternating muscle body aches, swelling, these are typically things that you'd see that are part of a normal acting immune system, but when it continues is when we get into trouble. When we see bowel changes from alternating diarrhea, constipation, we also see different types of maybe gas or bloating or belching, if the microbiome in the digestive tract is off. We may see additional allergic reactions as well too, where essentially we don't have a response that's happening that we're used to, like respiratory. We don't have sneezing and our bodies can't get those things out, but essentially it starts going to digestive issues as well. It might create joint pain and muscle pain. We also see these comorbidities tend to make us more susceptible for immune health. Diabetes, cardiovascular disease, kidney and liver disease, which can't help with the breakdown of different toxins, can't break down our own hormones properly, then there's an accumulation in the body that affects our immune health. Some of our immune factors have to be broken down in the kidney and liver, and if they're not functioning properly because of other types of diseases, including respiratory diseases, then we can't function properly as well too. It's putting more burden on the immune system. Also, cancer and other chronic issues are essentially burdening the immune system as well too. So if we don't address these along with autoimmune diseases, we're not able to really help boost our immune system. We have to look at the types of diseases that require more immune support and treat those just as long as boosting the immune system for the current pathogen or infection that we're thinking of. So before we move on to the next section, we're going to talk about natural treatments and kind of looking at how to boost the immune system from a different perspective than they do with conventional medicine. I want to just say that the comorbidities that we mentioned before are essentially an issue when it comes to the immune system because the body is already struggling to deal with the diabetes issues and the side effects that that's creating. So there's issues with blood flow, with blood sugar handling, essentially with other types of conditions like liver and kidney conditions. There's already strain put on the system, so that's going to take and be much more difficult for the immune system to function properly when those comorbidities are there. Plus, as you'll see later on, sometimes some of the same ways and receptors that are in some of the tissues that are affected by these comorbidities, they are also affected by the current infection. So the immune system goes off to fight the infection, and then all of a sudden they're fighting those tissues as well too. So as we move on to treatments, one of the things we want to look at is a immune myth or misunderstanding. And is the cure all about finding the newest antimicrobial treatment to treat the pathogen? And this isn't necessarily true. And so what we want to actually see is when we look at how viruses are fought, from a conventional standpoint, or we look how we do it naturally, sometimes we're actually going back to some of the types of treatments that we used to use that just tries to clear things out of the body, that we use some of our innate immune system to help instead of having to find a new drug or treatment or put in a big combination. So it's very interesting that we have to specify what we want to treat. It's not always about just killing the bug. We have to make sure that the body's actually strong enough to do that for us as well too. Again, the immune system is so complex that it should be able to take care of us most of the time, but when we're weakened by some situation, it's going to make it more difficult. So we're going to kind of look at a little bit of different kind of thoughts and patterns on how we would try to eliminate different pathogens in the body, and that helped us kind of explain where we came up with some of the immune ways of treating now. So we're going to look at a slightly different approach to the immune system, but we have to ask the question, can you boost the immune system? Since it's so smart, since it's be able to do this, if we're not immunocompromised, can you boost it at all, and what do we want to? There's certainly some situations where if someone, say, has an autoimmune disease, where if you boost the immune system, you would think that it would overly aggressively attack the tissues we don't want it to treat. So it's well within means to make a question there. And a lot of times people in the conventional world think the only way to boost the immune system would basically be either kind of herd immunity, to get exposed to a pathogen that you're going to build your own antibodies to, or essentially get a vaccination. Are there only a number of ways to do it? No, absolutely not. And there's ways that you can combine things together, different types of therapies, different types of treatments, as you'll see in just a few minutes, that work to the synergy of the body that allow it to do it the most effective ways. And some of the other things when we think about the immune system is, can we do this? Can we detect issues of the immune system without becoming ill? Absolutely. There are signs and symptoms that we use now that are showing us that that innate system, the inflammation response that we originally have, may be hindered or are going too reactive, like swelling, fatigue, chronically getting ill, never feeling like you get sick. The people that never get sick in life may not be able to have an immune system that's reactive enough to respond. So we want to make sure that having the common cold every now and then, that we're able to clot properly, and we don't get infections with different cuts. That's the good sign that the immune system's actually working, and we can actually heal ourselves. And some of the approaches that we're going to talk about, are they fact or fiction? Do they have scientific background? Absolutely. And the great thing is a lot of the natural things that we're going to talk about have been around for a number of years. A number of different medical cultures have actually used these approaches in combination, or the idea that they were putting forward has been there. And the great thing is that the more science actually delves into, say, herbal medicine, homeopathy, chiropractic, acupuncture, the more we're able to prove this information to people, that there is scientific modern day terminology to explain how we're using these procedures or these different therapies to help out with the immune system. Below here is actually an interesting thing. When we look at the whole body approach, one of the ways that I kind of do this currently with my patients that are coming in with COVID scare, or they're worried about their health, is I break it down and say, if we worked on these 3 things alone, it would make a big difference. If we worked on boosting your immune system, so individualizing their treatment and care for you where you are right now, as well as that long-term goal. If we work on your stress and your adaptive response, so how are you going to deal with the chronic everyday issues? And then also looking at emotionally helping the patient to help support them so that they can deal with currently what's going on, and do they feel supported going on into the future as well too. So we're looking again at that triad of health, the structural, biochemical, mental, emotional, but we're kind of putting it in terms that patients are used to hearing, the public knows about. They want to boost their immune system, they want to be less stressed, and they want to feel like someone's able to take care of them and they can feel emotionally stable. So that's another way of looking at the whole body approach to the immune system. So one of the interesting things as we move forward is that we need to look at some of the ideas that originally came about. Before Louis Pasteur was able to discover penicillin, and we had our first antibiotic, it was interesting because they would think that pathogens were created by evil spirits, that they were, the plague was basically either food or a reaction from doing something wrong. So when Pasteur was able to kind of, with the first antibiotic, they found out, okay, we know we can identify certain pathogens and we can use things to treat them. But when Pasteur was actually nearing his end of his life, he said one of these things. He says, it's not the germ we need to worry about, it's the inner terrain. And then he also said it was the microbes that will have the last word. So what's interesting with this is we see him basically saying, we were able to find the medication that works for this, but we need to work on the person itself. And at the same time, he might have been on track with the idea that the microbiome that lives within us, all the millions of bacteria and their genes, are basically having so much say on what we do that we are our microbiomes. And so he's not necessarily possibly talking about the negative microbiomes, but understanding that we live in a bacterial world. We are always exposed to this. So how do we move forward with it to come up with the best treatment? So let's go back a little bit and learn from the past, because I always thought some of this was interesting when you look at how chaotic and kind of vague some of these treatments for different types of illnesses and infections and bacteria were, but it actually kind of shows us where we're kind of going now into the future. So on this slide, you have a number of different pictures. And so you have bloodletting that was done to let out either evil spirits or the evil toxins of the body. Notoriously, George Washington developed sepsis from this and passed away, or that's what's said. So we saw that practice happen in the Middle Ages quite frequently. We would see physicians giving certain types of formulas and tinctures and tonics to bedridden people to see if one toxin could essentially help another one. In Chinese medicine, this is notoriously seen when they used to give mercury all the time, thinking it was going to prolong their life, and it really didn't. Another way of kind of looking at how do you get rid of everything from demonic possession or almost like anxiety and depression to an infection was to give purgatives and laxatives. So basically you try to remove the pathogen from the body one way or shape or form. There are certainly some herbs in there now that are still available that can definitely do this. We don't tend to prescribe them, but essentially what we want to do is make sure that we stay away from certain ones of these, and luckily this isn't the current way that we treat people, but there's a different version of it. And then in the last picture we actually see is a sanatorium, like what Dr. Kellogg used to do. And so people would go to a retreat, and essentially they would go in and they would have their diet fed to them. They might do different types of therapies, and then they would basically relax, and these therapies would be done to them to help them for different reasons. So overall, we would basically start to see different interventions used that involve being outdoors, and different food interventions as well too. So it wasn't just about getting out what we could potentially get out, but essentially what it was also about is supporting the body. So we see this in a number of different ways, and so as we move forward, we kind of see modifications of these treatments in the current way we can look at the immune system. So these are thinking outside of what antiviral, antimicrobial property, or medication do I use to treat a certain pathogen, a certain bacteria or virus. Now we're starting to feel like, how do we work on the whole body? So we talked about purging and elimination before, where certain herbs were given to basically expel pathogens or worms. Now we kind of look at that as, how do we change up the diet? How do we put good food in that can kind of help to balance things within the system? A lot of times bitters are used, say, to help with digestive health, to move things out as well too. Rhubarb can be used in Chinese medicine to kind of help bind to substances, along with different types of fibers to help clear stuff out, especially if you're talking about, say, parasites. We kind of look at how is bowel health overall. How do we move the bowels? Many of the detoxification processes, whether they're a short period of process or something that we do over a long period of time, where we're taking inflammatory foods out, or we're trying to detox the liver or the kidney. A lot of these different types of detoxes will use foods and herbs and substances to help with movement, to help remove bile, to help remove these substances that are getting stuck or congested in the system. So it's about as close as we can get to our purging and elimination as they did back in the Middle Ages. When we look at the sanatoriums and the retreats, what's important about that is that people would go to these for a longer period of time. And so while all of these different things were happening to them and they were going through these different procedures, they were resting, they went on vacation. So unfortunately, we don't have the luxury most of the time to do that for ourselves. When we get sick, we're supposed to stay home. We're supposed to give ourselves enough time to rest, to get better, and then we may return back to work. But we don't tend to do this, especially if we're detoxing as well too. We tend to do that and work at the same time, instead of just allowing our body just to detox and that's enough. So when we hear about the importance of sleep and rest, and that the immune system and the digestive tract, all this stuff happens during our REM sleep, we really need to start to improve our sleep quality overall. Other things we can look at is hydrotherapy techniques. So these were basically done in the 20s and 30s in Europe especially, and they would have things like these plunging baths that you see here, where one bath would be full of hot water, the other one would be very ice cold, and they would go back and forth between the two, which creates this kind of circulation issue where blood gets pulled to the skin and then gets sucked back in. And so overall, what is that doing is it boosts the immune system by helping moving blood flow. So some of these things that can be used on very small portions of the body, like doing ionization foot soaks, can be done for the full body as well, and are a real basic way to kind of help boost the immune system no matter what's going on. Bleeding techniques, like we saw before with bloodletting, they typically can still be done in traditional Chinese medicine. Ayurveda is a way of blood cleansing. When people have sore throats and you're treating them with Chinese medicine and acupuncture, there are points that can be bloodlet with a small puncture, and that helps to clear heat from the body. So essentially, you're still moving some of these fluids that might be creating some kind of toxic buildup. Clearing heat and removing toxins is one of the ways that advancing signs of COVID was treated in China during the first beginning of months. But they didn't use as much bleeding techniques as far as we saw. But we do see this happen. We look at if someone has a lot of blood stagnation, maybe the varicose veins, to do this. And looking at lymphatic drainage as well too, another technique that came around probably in the 1920s and 30s in Germany and started to spread. And at home, instead of having access always to someone who can do lymphatic drainage, which is training in a trained technique all by itself, we may do something like dry skin brushing, where we're trying to move those lymphatics and to basically help the circulation, get everything back to the heart. It's a very light touch that goes upwards from the bottom, kind of on the inner or the soft parts of the skin. And you're basically directing everything towards the heart to kind of help lymphatic movement flow. So basically you're helping that waste disposal system move out what it needs to do. So these are basic techniques that some of the original ways that it started sounds very, barbaric to us now, but essentially we do modernization and different versions of them now as well too. So it kind of helps us treat the immune system without being so specific and picking out individual things that work for one microbe or another. We work on the whole body again. So that's the key common fact that you're going to see with natural treatment is working on the whole body. So as we were just talking about looking at older approaches to treat something that's more current and new in the patients we currently see now, or when people have interest in this, we want to look at traditional Chinese medicine. It's been anywhere from 2,000 to 5,000 years old. And the amazing thing is they have manuscripts that have been treating epidemics and disease for over that period of time, and they do that multiple ways. So they combine the use of acupuncture, they combine the use of herbal therapy, dietary therapy, movement skills like martial arts, Tai Chi, Qigong. They use a lot of different aspects because it's a whole holistic system, but then it's its own medical system by itself. And until more recently, that was combined also with Western medicine in China as well too. But it's amazing to see how they're still using currently traditional Chinese medicine sources and herbs with, say, the modern epidemic of COVID. There's a lot of research out where they were using certain traditional formulas that were used as preventative formulas, and like I mentioned before, to treat what they would call heat or toxins, which is basically inflammation that's going to rise. Looking at the cytokine storms or bradykinin storms. How do we calm the body down so it doesn't be so inflamed and create more damage in tissue, say, to the respiratory tract? And how do we help people get into recovery? So what they noticed is that things like Chinese medicine work best at certain periods in time, like at prevention in the early stages, and then more so in recovery, where they would use Western medicine for the more medium cases and more severe cases until the patient kind of recovered. So what's interesting about traditional Chinese medicine is that it also relied on the observation skills 2,000, 3,000 years ago. They didn't have lab tests and imaging tests. So basically, the practitioner has to be very aware of what's going on with the patient. I always tell my patients that they know themselves better than anyone else. So when we have a conversation, I'm looking for those little changes that they might not have told the doctor before or it didn't mean anything. So those little observations tell me where we need to start, where we need to do with treatment as well too. Is there other issues with their current immune health that aren't coming through yet? So we use different types of treatment, but especially acupuncture and herbs as well. And there's a variety of traditional therapies that have been brought up, and they've done more and more scientific research to find out exactly how they're working in the body, as far as showing how acupuncture can move blood flow to and from a different area where the needles are, to show that it has an effect on the nervous system, the endocrine system, and that's to treat a number of different things, not just immune issues. But what's interesting with the immune system is in Chinese medicine, the lungs kind of govern the immune system, which would make sense. It's our respiratory organ. That's where we get our coughs and colds and how we get the sniffles and sneezes and sore throats when we're first getting sick. But the lung has a connection with the large intestine. So now we start to have that idea that's more present now, that the microbiome of the digestive tract actually has a lot to do with our immune system. So in Chinese medicine, that lung-large intestine connection is something that they kind of noticed a long time ago. And so we can use this to our advantage to say they were onto something. They're not completely off base. The lung also serves, it governs the skin, so it takes care of the skin. So that's our outside protective barrier as well too. It's where our mucus layers are. So it's basically our innate immune system when we treat the lungs. And so what we've noticed is that different areas in Chinese medical history were prone to certain diseases. There were herbs that came up from northern China where they were treating what they call the cold diseases. So they had to warm the person up. They had to give them nourishing herbs that made them kind of sweat things out, that would kind of build up their immune system. And as time passed on and people moved more south where it was a warmer climate, they would now have diseases where they had to cool the person down. They couldn't give those warmer herbs. So different areas of the world or different locations had to change how a treatment was given. So we see that whether we're treating someone, say, on the East Coast or on the West Coast in a dry environment versus a damp environment, we know that the weather change here when it gets colder during the winter and it's less humid is when our immune systems have to work the most to prevent, say, cold and flu. We start seeing more humidity and things start to grow in spring and fall, and we have more issues with allergies. So the immune system has to be addressed in different ways, just like they saw in China as people move from one area to the other. So one of the main things is they would treat the pathogen, but they also worked on making sure the body was strong enough to actually treat it. So they had some of those herbs that were very purging, but they knew that the body couldn't handle it. So they had to make sure we gave some kind of support back. And a lot of that support ended up being digestive support to make sure the person could actually get food in while they were actually being treated. They got nourishment from the outside sources. So they would support the body while it changed, and then they would change their treatments quite frequently. So patients didn't stay on herbs forever and ever. They may only be on it for a day or two, and if the symptoms changes, they would change it up. So the same thing was noticed when the information that's come out of China when they were fighting COVID is that they would change up the herbs that they were constantly using depending on where they were in the different stages of illness and how that patient presented. So when we look at traditional Chinese medicine, especially acupuncture, the great thing is that using acupuncture can do all this to help out with the immune system, but also to heal other areas of interest as well too. Everything from pain management, which usually brings people in for acupuncture, to working on digestive tract and reproductive health as well. So it's improving whole body circulation, including red blood cells and white blood cell counts, decreasing inflammation response, supporting the digestive health by actually helping the body to stimulate breakdown of food, to stimulate bowel movements, promoting stress reduction and function by helping to release endorphins. So endorphins are our body's own opioid substance, so it not only keeps us relaxed, but they also work in the pain management sector as well. It helps promote physical balance and strength without having to tax a patient. So I've had patients that we need to help move more blood. They can't get out and exercise. They may have a physical injury that blocks them from doing that as well too. So we can use acupuncture to help them stimulate as if they're moving their blood, to get more blood circulating to areas that need to heal, like say a broken leg that you can't needle. You can certainly help get blood flow down to that area that's now in a cast or boot. Remember, that's part of the immune system too, is the healing response. And it does affect the different areas, like I said, the nervous system, the endocrine system, through the HPA axis, which has been seen scientifically proven too. But most of all, it helps recovery with stress and physical ailments. So when we think about the current epidemic, and even when we're getting over any kind of chronic long-term stress or a long-term illness, there's going to be stress and emotional issues related to that, but it's going to be in the long haul. So what we have to do is make sure the body's able to go along with that, and then once they get better, they're able to recover. So down here you see a number of different stages that you would have to take into consideration with different people and where they want to go and present different types of treatments. Are they in a preventative stage? Are they in the early stage of a disease? Is it progressing more frequently and more rapid, going more internal to the body and coming deeper, or are they in that recovery stage? One of the best things that I always remember with Chinese medicine as far as boosting the immune system was the preventative stage, so treating things before they needed to be treated. And you saw on the last screen, there was a red screen. There's literally a formula called Jade windscreen. So it's like you're building up this windscreen in front of somebody so they don't have any of the pathogens that can get to them. So they really emphasize the preventive medicine part in the early stages of treatment, as far as all the current modern diseases that we think of now. So using that, it's kind of thinking about things ahead of time instead of waiting for the end. So that can be done with acupuncture and with Chinese herbs and different types of exercise routines, along with other types of therapies as well. So just as Chinese medicine and our overview with acupuncture and herbalism and traditional Chinese medicine has moved forward, so hasn't just herbalism and herbal medicine and immune support as well too. Herbs have been used from a lot of different cultures across the years. What's amazing when you study herbal medicine is you start to realize that a lot of things, again, were based off of observation. They saw animals eating herbs on the ground. They did experiments on themselves to see what was the right dosage on things. And then they were able to tweak and modify. And as herbalism has grown and science has gotten much more into trying to figure out exactly the mechanism behind different herbs, they've been able to pull out the individual constituents and say, oh, this is the substance in this particular herb that creates these effects. And they're able to replicate it. So you're seeing some herbs that are used now based off of how strong or weak they are, based on how much they have that particular substance. And different herbs have different properties that you use in different areas. So true herbalism is more than just going to the market and knowing that you have the selection that you do now, but knowing how to use them properly, how to dose them correctly, and how to use them in the right base together. What you see a lot of the times is people will bring up the idea of a single herb, and we're going to have a list of single herbs. But most of the time, those single herbs weren't used by themselves traditionally. They were put in formula so they balanced each other. You may have an herb that was, say, more toxic, and it was used along with another herb to balance it and help, what they would say, harmonize in Chinese medicine, but to help smooth over its effects so that it was more digestible, it wasn't as toxic. But those herbal formulas are really interesting too because they created a synergistic effect. And what we want to do now in modern days is create a synergistic effect not only between the herbs that we select, which is why you see a lot of immune boosting products that have multiple herbs in them, but you want to do a synergistic effect between all of the different therapies a patient might be doing. So their exercise, their diet, any supplementation, even their medication, because you have to look to what's going to balance the person the best. You don't want to have to worry about any drug-herb interactions. You don't want to have to worry about, is this going to be too much for that particular person's constitutional type? Is it, if they're weak, you don't want to give them stuff that's too strong. So herbalism across many cultures is kind of interesting to study, but you see trends that keep popping up. And so we're going to see some of the trends that the herbs that I put in the upcoming list that have basically been shown to kind of have the same ideas. They went after a certain part of the system, like a antimicrobial, and then they supported the body, and then they helped with digestion. One of the other things that when people don't think much about herbs or they can't do much is you have to remember there are a number of herbs that serve as the basis for different pharmaceutical medications, including cancer therapy drugs. So mistletoe being one of them was a well-known cancer therapy drug that was converted into a medication. So they do have the potential of being very much dangerous. So you do want to work with somebody, even though you'll see lists that says these are the immune boosting herbs. Putting them together to actually make them the best for what you're going through at that time is going to work well for you. And it also works well if you're looking for something of more of a preventative nature to keep safe and healthy before something happens. So preventing, say, COVID is what we want to do. We talked about this once before and kind of looking at this idea of immune boosting herbs. Are they going to overactivate a system? And what's interesting, and there's a couple of particular herbs that keep coming up a lot with this. The biggest one is echinacea, which you see here. There are 3 different echinacea species, and a lot of times you'll see echinacea sold as either Echinacea purpura, which is the American echinacea, or you might see the 3 species put together with angustifolia too. But the main thing to take from this is that these herbs are immunomodulating herbs. And so that's different than like a true immune stimulating herbs. When we think of stimulation, we do run that risk of overstimulating an active system. So that concern is very much real. But immune modulating herbs, what they do is if we need to turn something up, it can do that. If it needs to turn it down, it can do it as well too. It's similar to adaptogenic herbs when we work with the adrenalins and stress formulas. So a lot of these herbs that are mentioned here, when they're taking over a long period of time at a low dose, they're immunomodulating. They're not just there to stimulate. They're certainly not there to decrease the immune system. You would actually look at herbs for anti-inflammatory, antihistamine if you wanted to bring the immune system down. So there's a lot of different ways of kind of using these herbs, but most people also have to take in consideration that they should take herbs when they're needed, as they're prescribed, and not to over increase the dose so that more is better, or just take it because they heard it was great for them in particular. So working with patients, or with someone who knows what they're doing with the herbs is a much safer way to go. So here's a list of immune supporting herbs, and this is only a very small amount of immune modulating herbs that you see on here, and they come in different shapes. They're taken different ways. Some of them are tinctures, so they're an alcohol base that you can mix with water. Some of them would be encapsulated or in tablets, but often, like I said, you'll see them in groupings or pairs together. So some herbs are put in here like echinacea, astragalus, golden seal, astragalus, which is Hong Chi in Chinese medicine. They're there to really boost the immune system, to move the blood flow, to get the immune factors, the different types of white blood cells throughout the body to fight off infection. And because back in the day, especially with the Chinese medicine, they didn't know which bacteria was causing what or if it was a virus, so they would just kind of generalize it. And so they were like broad spectrum herbs. Then they would start to get into more herbs that essentially have a finite focus for certain parts of the systems. So elderberry, while it's immune stimulating, also likes to go to the lungs. So you see elderberry syrup being very popular right now for respiratory health. You see uva ursi, cranberry used a lot when you're treating UTI, bacterial infections of the urinary tract. You may see other herbs like stinging nettles used a lot for urinary tract infections, but also it helps out to balance hormones. So it's used a lot in prostate conditions, this prostatitis and inflammation there. So a lot of these herbs are used together in different facets. Blue plum is one of the widest herbs that is used in Chinese medicine and across China and Japan, which was an herb that was used first for respiratory issues, early stage kind of respiratory issues, with alternating cold and flu, maybe alternating diarrhea and stools. And what they noticed is when they did modern research on it, it actually would have the ability to affect the liver. And so then it started to be used as a formula or in other formulas to basically help out with hepatitis. It was able to help support the liver. So each one of these herbs have so much more to it than just immune boosting or immune modulating substances, that you can use them in combinations to really drive that immune factor to a certain area of the body. And then you look at something like Manuka honey, which is not necessarily an herb, but it's been used topically to certainly help out with healing, to help out with infections that don't want to heal well. It's also been used internally to help out with local seasonal allergies if you can get local versions of it. So it's kind of antihistamine properties are there as well too. And on the bottom, you can use food type of substances as well, that a lot of times when you look at ginger and garlic and olive leaf and cinnamon and cardamom and fennel, they're adding a little bit of heat. We use these as culinary herbs because they help out give them flavor, but they add heat to the substance. In a formulation, they may also add heat to a substance that helps it digest better. So there's a lot that goes into making these immune formulas work together, but certainly golden seal, echinacea, astragalus are some of the main formulas that you see used over and over again and supported as immune boosting herbs, along with some of the vitamins and minerals we're going to talk about in just a moment. The herbs that we don't think about from the immune system is actually the adaptogens. And this is kind of sad because we talk about this all the time. The adaptogens help us deal with chronic stress. And what ends up happening is that a lot of different cultures use different types of adaptogens, but we don't really think of them as immune boosting. But if the body's having to fight something over and over and over again, then we know we have to be able to support the body. The adrenal system can only handle so much. And then again, it has to kind of find out where to spend its energy. Do you want to make sex hormones? Do you want to deal with water balance? If the immune system's always on go, your body's always expending energy that it doesn't have. So a lot of the common ones that you see, or some of the common herbs or adaptogens that you see being used, can often be discussed at treating other things as well too. The different types of ginsengs or manroot was always a vital herb in Chinese medicine, but they would use ginseng tea right from the root to kind of help out with longevity and life. Same thing can happen during the immune system, is we want to make sure we have that support there so we can continue fighting off infection. Licorice root has been one that's been used more and more. Most people have used it as an adaptogen, but that they've also used it because it can kind of help coat and smooth things. It's got a nice taste and flavoring. So this is true licorice root, not the candy version. But with these, you also have to be careful with licorice root because it can affect blood pressure issues because of its ability to hold potassium. Rhodiola is one that's especially used now because of its ability to actually go to the lungs. So it really likes to help people relax at night, but it helps to open up the chest, helps out with breathing as well too. So again, these are in combinations. Ashwagandha or withania is commonly used even by itself. And that is essentially is one of the Ayurvedic herbs that really crossed over into Western botanical medicine. And it's kind of considered the Indian ginseng, basically. So it's been used to kind of help give vitality back to the body that needs it the most, and it's less warming than, say, the ginsengs are. And holy basil as well, too, is one that you commonly see used to kind of help with this adaptogenic effect and kind of helped the body maintain and move blood flow throughout the system while it's trying to heal or go through chronic stress. So a lot of these are going to be important in using adaptogens during the recovery phase as well, too, to make sure that the person can, now that they fought the infection off, they can still kind of survive and function at the same time. So just as we talked about herbs being used in combinations and in these combination kind of immune boosting formulas, you will often see a lot of the vitamins or individual supplements being used or mentioned as immune supporting properties. And so we have a list of them here, and this list also tends to have a little bit more of a respiratory function. So these would definitely be ones that we would look at not only to promote immune health during the full year, but especially during the winter seasons, going more into cold and flu season. There's certainly ones that we promoted at the Roselle Center for Healing as COVID prevention and kind of keeping the basic immune system up. So that's one of the main keys. They're still working at trying to support the body no matter what's going on with it, no matter what virus may be out there. We need to support the generalized immune system, and then that will be able to fight off things. And then we can increase the doses on certain things depending on what the individual is coming in for. So things like vitamin C and other antioxidants like quercetin and vitamin E, A, selenium, all those antioxidants are going to help with some of the stressors that are being produced and the oxidation stress that's being produced when the body is breaking down some of the inflammatory markers and pathogen. There's that waste material, so it helps to kind of balance that. Vitamin C also works for adrenal stress, so it helps out with the immunes, and it helps to prevent the deterioration of blood tissue too, so the circulation can help. It's been already shown that IV vitamin C for COVID patients at a higher dose was able to help with the recovery and less severity when they were already in the hospital situations. They were able to get out and the recovery was quicker. Vitamin D3 is always going to be lower, of course, in the winter, and if we have darker skin, because we can't absorb it as much into the sunlight, even though nowadays, because we have sunscreen on, we don't get as much of it anyway, and we're always inside. But we know we need to increase and always measure vitamin D levels, especially around times when we think there's increased susceptibility to different types of pathogenic infections. One of the reasons they think that the Spanish flu of 1918 might have been as popular as it was is that they might have had lower vitamin D levels because everyone was starting to move from the countryside and the agrarian society into the cities, so they weren't getting the same foods, they weren't getting the same sunlight as they were before, so their vitamin D levels were going down. Zinc is another big immune booster. It's high in white blood cells, and it actually can help inhibit pathogen replication. So zinc has been given alongside some of the medications that you've been hearing about in the news to fight off viruses because it has to deal with how the virus gets into the cell and kind of helps the medication basically get into stop replication. It can't pass on its DNA and RNA. And it's also been known for helping out with respiratory support, so it has an affinity for the respiratory tract. L.Ac is another one that essentially helps to thin out mucus secretions. So this would work for your allergy patients. This would work for respiratory issues. It's also a precursor to glutathione, which is used in the liver to help detoxify. So as the body's trying to deal with some of the after effects of breaking down pathogens, it knows how to do that. It's also going to help prevent the liver from getting toxic overload from the medications that may be coming in to fight off such infections. And it's been shown to increase cellular repair. And quercetin, like I said before, is a bioflavonoid. It helps out with tissue repair and also it has an antihistamine effect too. So a lot of these particular ones have a little bit more of an effect on the respiratory tract, so they'd be really important during this current time. We have to worry about microbiome balancing. So this is basically looking at making sure we have the good bacteria in the gut that can be in balanced so we can fight off anything that comes in. There's so many different bacteria, it's hard to put everything on here, but there's different bacteria, different portions of the digestive tract. There's bacteria and different mucus secretions as well too that we work with it. So we don't want to kill everything off. Unfortunately, when we take something like antibiotics, it kills off the good bacteria and the bad bacteria. So a lot of times we're paying repair practice and we have to build somebody back up after they've actually done some of the medication treatments. Going along with that is digestive enzymes, which taken away from a meal can actually help reduce inflammation. So it may be another way of these cytokine storms that are kind of happening to kind of decrease inflammation so it doesn't go overrun. By breaking down the pathogens biofilm or kind of the layers around there, you're able to make it more susceptible to other types of treatments to get in there too. So digestive enzymes is not one that you hear a lot about, but it certainly helps out with digestion, but taken away from a meal serves a whole different function. One of the other things that we look at, and we mentioned before, is the herbal immune support, but using antimicrobials along again with systemic support, the adrenal support. Putting that in there as part of the whole mix is going to be beneficial. Systemic support, again, trying to basically treat the person where they are now, keeping them healthy where they are now, and working on any of the other comorbidities, any of their other illnesses or issues, is going to put them in a better spot to help improve the immune system in the long run. Different types of homeopathics can be used constitutionally or specifically when things are going on. Such things like belladonna has been used for high infections. Phosphorus has been used for green nasal discharge. And urticarians or stinging nettles in homeopathic form has also been used for essentially treating allergy issues, and homeopathic coffee has been used for someone who can't sleep well. So there's a lot of different things that homeopathics can do on an energetic level that's not going to interfere with some of the other processes. Oscilloscaninum, which I never pronounce right, which is a flu-like remedy, has been on the market for a long time now, and it's a combination of homeopathics that kind of help with cold and flu types of symptoms, which has been beneficial for some patients. And we also want to look at different activities, things that the person can do other than just the holistic therapies like acupuncture, massage, lymphatic drainage, chiropractic care, and exercise by itself. We have to get a patient moving. We need your muscles to help move blood flow, to move the diaphragm, to move the connective tissues, so that way your immune system has a place to go. Not moving, it makes us just as sick as it's not doing. So that's why when they talked about sitting is the new smoking, we're not moving as much. And no more could be truer than right now is we're at home and we have to deal with our new situations of teaching from home and learning from it in front of a computer for so long that we're not moving the way we need to. So some basic movement, stress management to give ourselves that time to come away, to allow ourselves to do what we need to do to de-stress, to get good, proper sleep and rest is all going to be part of enhancing and boosting the immune system. And also don't forget the mental, emotional support, because essentially when I talked earlier in the year about how emotions affect the health, we see more and more information coming out that looks at that particular process, which was used to be just pushed aside. We didn't really worry about the person's emotion if their physical body was taken care of, but now we're seeing how anxiety and depression is leading to things like heart disease and cardiovascular disease and other types of physical illnesses. So we have to make sure we support that mental emotional side. From that previous lecture that I just talked about came some great information from a webinar that I had mentioned previously, and I just wanted to bring it back up that one of the leading mental health specialists in the area, when he was talking earlier on in, say, March about COVID-19, he wanted everyone to realize that there's been prior evidence with other types of traumas, things like 9/11 and with Katrina, that essentially they saw an increased rise in mental illness and different types of issues like PTSD. And it's consistent with other types of outbreaks as well, too. So we're bound to see more emotional health issues come to the surface. This is an ongoing stress. So even though the current situation might be over, people are still having issues with this. So this was a great lecture on how this kind of takes place. And they saw that issues such as diabetes and other co-infections were continuing even after the outbreaks that they were talking about had gone away. They still had mental issues going on. There was still stress, especially PTSD. And I can't imagine more so with COVID-19, where everyone thought it would be done, and now we're 9 months into it and we don't know what's coming up, and there's new stressors every single time you look at the news. So definitely need to start thinking about the person's emotional health, making sure they have some kind of support system. And if they don't, how can we try to help that with more natural causes? So one of the things I want to keep stressing is to treat the whole body. Sometimes our immune health is so in front of us that we want just the one particular thing, the one herb, the one pill, the one treatment, and we're done. But if we continue to treat the person and keep them healthy, their immune system is going to be that much better, and staying ahead of things. So here we talk again about comorbidities, comorbidities that essentially are happening in the body. And when we look at COVID-19, we know that there's a connection between the ACE2 receptors and where different sites of inflammation is happening, causing breakdown and lung failure, organ failure. But if we go back and treat the root cause, if we find what's really going on, we can start to help to prevent some of this. So we look at some of the places that are being affected by more severe cases of COVID-19. These receptors, which we could treat ahead of time because they're really more so related to cardiovascular issues the way we normally think about it in modern medicine. But these receptors are in the respiratory tract, they're in the digestive tract, they're in the nervous system, they're in the heart and blood vessels, and they're in the liver and the kidneys. They're also in the eyes. Some of these non-respiratory symptoms that we're seeing people come through that have tested positive for COVID is because of these receptors in the other areas. So it really truly is an example of not just thinking about different types of infections as a skin infection or a respiratory infection or a digestive infection. You have to really think about how are they affecting the rest of the body. So here's a perfect example of some of the ways that it's affecting the body, how it's altering things. But if we went to treat these and someone already had respiratory issues and they weren't being treated, their immune system could suffer even more. So we see problems like this happen over and over again with other types of viruses as well. And that's why we have to treat the whole body, not just the one condition. So one of the ways we do that is we can look at regular lab testing that someone does and make sure that they're up to date on their lab tests. That's kind of difficult right now because sometimes people can only do testing or do doctor's appointments via telemedicine, so they can't actually be seen. Their pulse can't be taken, their heart can't be listened to, but they sometimes can go and have lab testing done. So I broke this slide down into a couple of different things where we look at things a little bit differently to make sure you're in an optimal range and not just on one end of the ranges, which could still considered well. So under the general wellness, you're looking at everything like your white blood cell, red cell cell count, your Chem14 panel covers everything between liver, kidney functions, glucose function, looking at your enzymes, liver panels, lipid panels basically cover, your good cholesterol, your bad cholesterol, your total cholesterol, looking at thyroid function, which also has a lot to do with adrenal function, vitamin D, iron, and doing urinalysis to make sure that things aren't passing through the urine. The easiest way sometimes to catch a underlying urinary tract infection as well. There are a number of different inflammatory markers, and some of them are very specific and some of them are more vague. So ESR is an old school factor, but it's very vague, but you know that if that's really high, that there's some kind of inflammation going on in the body. It's worth further investigation. Homocysteine tends to have a little bit more related to the heart, same thing with CRP. And ANA is another one that's a little bit vague, but sometimes you'll see this pop up in certain autoimmune diseases, so you may need additional testing. When we look at blood sugar monitoring, we want to see hemoglobin A1C that looks at your blood sugars over a 3-month period and potentially insulin to make sure that there's not a resistance issue going on. And then you can get into different types of additional testing or specialty testing depending on what the patient presents with or their past medical history. So taking a history and finding out what medication someone's been on, where that might affect the body, what they've been treating for kind of helps us to go back and review to see where we need to go see if things are going right. Under the additional testing, adrenal stress index is a saliva test that helps us look at how your cortisol levels are doing throughout the day, not just one particular moment. A comprehensive stool analysis helps us understand how food is being broken down, and also if there is any parasites or bacteria imbalances in the digestive tract. So that in itself might be an indicator if someone's after taking an antibiotic that they didn't have a chance to regrow some of the good bacteria back. Looking at food sensitivities, food allergies, testing their zinc level, and their Accugraph looks at their acupuncture meridian system. Also trying to see if they are more on the acidic or alkaline range by doing simple pH testing strips that can be brought home by the patient and done in the morning by either saliva or urine to see what the internal environment is like. Obviously, the more acidic, the more easy it is for bacteria to grow and to thrive. And then looking at, again, their overall picture of the person in front of you. Do they have heavy metal exposures? Do they potentially have Lyme disease? How are their nutrients or their hormones doing? So there's a lot of different factors that we can take information from lab work that's already been accumulated by a regular doctor or do some additional testing to really optimize that person so their immune system doesn't have to use extra energy to fight things off. Here's a little case study that I put together of different things that would happen if someone kind of came in and say they were looking to boost their immune system. You'd want to sit down and go over the history, their lab work, what kind of medications they're taking, with their supplements and diet are like. You get to kind of see what you have to work with in front of you first. And then as you're working through that, you may do some of these other suggestions, like suggesting an anti-inflammatory diet to get inflammation down. Give them some warmer herbs or have them eat more warm foods or warm liquids in order to help with assimilation and processing. You may put digestive enzymes or fermented foods in there to help out with good bacteria. Making sure someone is hydrated, and if they're not, putting a little bit of sea salt for electrolytes in there to make sure that the water is actually getting to their tissues. That will have a lot to do with basically making sure that they're not chronically dehydrated because they're not just drinking water, but they're actually utilizing the water that they drink. And then you may put them on an herbal blend or a nutrient blend based off of what they're coming in for. We may want to start them with acupuncture to help improve blood circulation and stress reduction, or do chiropractic to help balance out the sympathetic and parasympathetic system, the fight-flight system, the rest-digest system, to make sure that they can really function the best from all angles. And making sure they're doing something for themselves too. They're making time for themselves, but maybe they're walking 30 minutes per day. They're doing deep breathing exercises to help move their lymphatics, to help move the respiratory tract. And we may send them home with lymphatic dry brushing or something to kind of help move their lymphatic system too if we think there's some kind of congestion or the body's not eliminating as well as it could. So there's a lot of different things we can pull together. They're going to work on the immune system from a lot of different ways instead of it just being a one thing. And it may seem like a lot, but essentially what ends up happening is you end up making the person stronger and they can deal with more things over a longer period of time. So overall, when we think about boosting the immune system, as we wrap things up, we want to think about when's the best time to do this. If I'm not feeling anything, do I try to boost my immune system now or do I wait till something's happening? Well, a lot of different types of medicines have told us, especially Chinese medicine, is that before the symptoms start, by doing things to help in preventive mode, is always going to be the best thing. The good thing is that you may not notice a difference when you're doing it, but it's going to help your overall health versus just a particular bunch of symptoms like respiratory symptoms or digestive systems. So there are always small things that you can do over time start to add up and actually help to boost your immune system naturally. Prevention and treating mild symptoms, and even at the end stage during recovery, have been the key in a lot of areas of using natural medicine. So if things were progressing, that's where we need to combine maybe natural medicine with conventional medicine and find the best mixture of both of them, whether that's with also testing and also trying to come up with the best treatment plan for patients and the public that's interested in using different types of means to improve their immune system. Individualized therapies have always been the way of natural medicine. So really you need to find out what works for that particular patient, what they've done in the past too as well. Some patients have come in, and especially with sleep, as they've tried herbs that are supposed to help out with sleep and all of a sudden they're awake. The problem is sometimes some of the herbal therapies have the opposite effect on people. So they might be one of the unlucky ones that can't do herbs for sleep. Where do we go from there? So we want to really try to figure out where that person is in a wellness state and if they're coming in with illness or some kind of conditions, so that we can work a little bit better on the body. And if their illness goes deeper into the body, we need to come up with a different way to treat it. We need a plan for post-illness conditions as well too, post-viral conditions in this particular case with COVID. There's a lot of natural medicine doctors that are already coming up with plans and seeing this happen. The fatigue that comes after being sick is a normal fatigue, but we can't let it last and linger. That's not a good thing. So what is the person missing that they needs to pick themselves back up? We need to go back and treat the core morbidities and make sure that we're addressing the whole system, not just the respiratory system, not just the immune system, but everything else that's going on. These might have been overlooked because of everything that's going on as well too, like not being able to get in to see your doctor, not getting normal preventative care. The fear of kind of going in and making sure that we're addressing also the environmental influences as the weather starts to change, that we're prepared for that as well too. And also the environmental issues such as pollution and toxins and estrogens and stuff, making sure the body can handle that as well, and we know different sources to kind of eliminate that from our lives as well. There's a lot of challenges that are going to come forward now and that are coming up soon as we move forward that are going to test the immune system. And here's just a list of just some. I'm sure you know more. But essentially what we need to focus on is what's on the right-hand side, finding stress management skills to make sure we're emotionally sound, that we've got some place to kind of do, we've got something to help enjoy our life with, making sure we're more body aware so we can tell physicians when we do go in, this is exactly what's happening, this is how long it's been going on for, so that we can come up with the best treatment plan for you. Now, the increasing rise of natural medicine and therapies are coming because people are sitting around going, I want to do something now. I don't want to just sit in my home. So even the scientific research behind that, as that starts to increase, people start to understand how herbs, how nutrients, how acupuncture works a little bit better for their body. Increasing connectiveness and making sure you're connected with your community, not just online in front of your computer. And know that the immune system requires time. We have time ahead of us, but we need the time in order to heal and to move forward as well too. One way of thinking about how to treat the immune system and thinking about the pathogens, whether it be a bacterial or a virus or a fungus, is thinking about it in reverse. How are they responding to our body? What are they doing? And how do we block it or alter it? Now, this is a great way for modern medicine to think about creating a vaccination or stopping something in its tracks or using medications to kill the bug or stop the virus. But essentially, we can do the same thing with nutrients and herbs as well too. But do we always want to do that? What are we taking away if we can't also support the body at the same time? We want to think about some of the way the old therapies have basically taught us some of the new things that we're using. Can we use herbs that we didn't quite consider before in the past in a different way because they may have different types of properties? We want to help to minimize side effects of current medications. So when we do have to use medications, we're seeing some of the side effects, we're seeing some of the lingering effects that are related to them. Use of prednisone has increased with autoimmune patients, with cancer patients, and essentially that creates more heat and inflammation in the body. So how do we help those patients when they have to take this medication? They're trying to stay well and they know they're going to be taking it for a long time, but we try to help support their body at the same time. Sometimes we have to think outside the box at a more natural therapy. And we want to learn how to optimize the different modalities, how to combine things together. Preventative measures that we're kind of taking social distancing with protective clothing, but looking at how our dietary changes, how acupuncture and chiropractic is able to affect our lives in a long-term effect, and also monitoring the outcomes to see what's working and what's not working, and getting the information out so that more and more people can kind of understand that they do have options. In review, I want to just say that we know that the immune system is a complex system and that it's there to keep pathogens from creating disease, but it's also there to help us heal and recover. An immune system that doesn't help us recover isn't working as well as it should either. The immune system should be there to be treated on an individual basis from person to person as well as where they are in their particular stage and condition. So someone who has a mild condition, mild version of allergies is very different than someone who has bronchitis and asthma, so they need to be treated differently. The same stuff is not going to work for them just because certain herbs work on the respiratory tract doesn't mean it's going to be appropriate for them. Therapies are not often regarded as immune boosts and can serve to strengthen the overall immune system. Working on stress management, sleep, digestion, activity levels, mental emotional health, all of those need to be part of the overall system of wellness and health and well-being instead of it just worrying about what our T cells and our B cells and our mast cells are doing. And we need to consider the structural, biochemical, and mental emotional support while we're enhancing the immune system as well too. The whole package needs to come together, and that's really the ultimate way to boost the immune system is by looking at the entire body and not just one particular part of it. Even though we're in trying times where the immune system is having one heck of a time dealing with things, we need to make sure that we're supporting every single person as much as we can and that they're part of the process as well too. So you are part of the healing treatment just as much as a physician or a medication or a supplement is. I want to thank you for watching this presentation on how to boost the immune system. I hope you got some information out of it. We do have to think about things from a natural perspective a little bit differently than trying to find the vaccination or the medication or the cure to any of the current situations that are going on. So it does involve your participation just as much as it does us kind of guiding you there. So one of the good things is that, thank you for listening to this. We're going to give you a gift, and we work with Caring for Others every single time we do one of these presentations. It's a 501c3 nonprofit organization. And the great thing is you're able to give something to you while you're giving back to others. Caring for Others allows us to basically work with those who can't afford natural care. And what we do is, in order for us to give them care and to help continue to educate the community, what we do is we give back your donation of $99 that allows you to come in for an acupuncture evaluation where we sit down and go over your health concerns, what you've done. We look at everything we talked about basically in this immune lecture and then more, and really try to come up with a plan that serves you. And essentially we can do that whether it's involving acupuncture and herbs, also dietary therapy. A lot of times we bring in different practitioners to kind of help out with what seems to work as the best thing for you. So for your $99 tax-free deductible donation, that money actually goes to help basically us educate the public more about what we do as far as natural solutions for common and chronic conditions. It goes towards scholarships for those that are pursuing careers in chiropractic, acupuncture, naturopathic medicine, kinesiology, and nutrition. So that way the future can basically start learning and kind of get involved. And also what it really does is it kind of helps us to just get people into the office and at a price that's definitely worth their while. This is $99 versus the $225 a normal new patient would be. So it gives us a chance to sit down and kind of come up with a treatment plan directly for you. I know some people are worried about the acupuncture part, but a lot of people have never had acupuncture, or if they've done it, maybe they've had good experiences or bad experiences, but trust me, I've worked them through that. And there's a lot of different options we can come up with, but we need to come up with what works for you. And this is a great chance to do it. So if you're serious about making changes in your health, I can walk you through what we do in our office to make sure that you feel comfortable and safe coming in, and happy also to answer any questions you might have. If you want to give me a call at the office, 703-698-7117. Happy to answer any questions beforehand. And then also, if you needed to get a hold of me by email, my email is s.pina@rosellecare.com. That's ROSELLECARE.com, where you can also on our website find some of the other previous lectures that we've done here on a number of different topics by some of the other practitioners that I work with closely in the office. So again, this is a gift for you. It's a $99 donation that's tax deductible that goes to Caring for Others, that allows you to come in and have an evaluation with myself, to really sit down and come up with a treatment plan that only works for you currently right now during this crazy time, but also one that's going to work for the future and help out with basically answering any of the questions that you might have. Feel free to contact me again if you have any questions related to this lecture, and I hope to see you soon in the office and talk to you soon as well. Thank you very much.